Hi folks, in this video I'm going to give you some tips on how to choose the best treatments, the best therapists and the common red flags to avoid when seeking out relief for lower back pain. So, you're suffering from lower back pain. What can you do? First of all, if you've suffered some sort of accident or traumatic injury, you should consult your doctor to rule out any more sinister causes of pain that require immediate treatment. You should also ask your doctor if they're familiar with modern pain science and the biopsychosocial model of pain. A biopsychosocial model of pain understands that structural abnormalities, which can be disc degeneration and herniations, are not always related to pain and can occur in people without pain. Because of this, a proper diagnosis cannot be made with an X-ray or MRI alone. A thorough injury and health history, as well as hands-on and movement assessments, should be performed before any diagnosis and cause of pain is determined. If your doctor is not familiar or willing to perform this kind of assessment, consider seeking out a second opinion before you commit to invasive treatments like surgery. In most cases, surgery is unnecessary, and the right combination of exercise, rest, lifestyle change, and mobility training will resolve most lower back pain issues. The right doctor or therapist will understand and embrace this approach and be able to guide you through the process. Now, let's suppose that you've been suffering with back pain for a few months, perhaps even for a few years, but you haven't found lasting relief. What do you do now? Which treatment is best for you? Is it acupuncture, chiropractic, physiotherapy, massage? Is it Reiki? Perhaps it's none of these. And why has one particular treatment worked for someone you know but hasn't worked for you? Let's go back to our biopsychosocial model to better understand why everything works sometimes for some people. Modern pain science research has repeatedly demonstrated that structure and posture are poor predictors of pain. That is to say that the alignment and physical condition of your bones and joints is not an accurate predictor of pain. It can be a part of it, but it doesn't tell the whole story. In fact, degeneration and wear and tear of the joints is simply a part of aging. It's quite like wrinkles on our skin. We don't expect these to hurt, nor should they. But many years of ignorance, bad science, faulty reasoning and marketing have solidified this idea that our bodies are fragile and sensitive to misalignment and structural abnormalities. The reality is that our bodies are extremely adaptable and resilient. Think of the tremendous physical feats human beings accomplish with basically the same bag of bones and organs as everyone else. We climb mountains, explore oceans, survive wars, give birth, lift weights, jump out of planes, and so on. We do these vastly different, challenging, and physically demanding things with the same basic constituents. The reason there is so much potential for human joy and achievement on one end and suffering on the other end lies in what the biopsychosocial model acknowledges. Structure alone cannot explain why some people thrive and push the boundaries while others can suffer for years. This model considers the context in which your body operates, your stress levels, anxiety, mood, your personality, your beliefs and self-talk. It considers your support network, your hobbies and opportunities for self-expression and emotional outlets, and it expands on the biological factors to also include your hormones and physiology, your nutrition, and so on. Simply put, it's a much more nuanced and individual view of your health and what may be contributing to your pain. Now, you might be wondering, how does this explain why some treatments work sometimes but not all the time? The reason for this is because all effective treatments have one thing in common. They give your body an opportunity to change and self-organize. You see, our bodies are self-healing. If you cut yourself, the healing process simply occurs. You don't have to consciously make it happen. Obviously, you can accelerate and aid the process, but it's essentially a self-guided process. Your body has the wisdom and knowledge to know what it needs, and it knows far more than you are consciously aware of. The challenge is in providing it with the resources and opportunities for healing. Healing and maintaining the function of your body comes at a cost. It takes time and energy. All treatments that work create an opportunity for your body to be at ease and to self-organize, or they create a challenge that encourages your body to grow and adapt. Generally speaking, treatments that create ease in the body and time for healing are passive treatments, treatments that you receive that are comfortable and enjoyable to receive. On the other hand, treatments that create a challenge are active treatments, such as exercise and mobility work. They require you to do the work and to acquire more strength or skills. Which treatment type is best is going to depend on what I call the health scales. They illustrate the demands or output of your body and the resources or input of your body. Output is everything you do that is remotely demanding or stressful, such as exercise, anxiety, work, smoking, injuries, etc. Input is everything you put back into the body to help it recover, such as sleep, nutrition, breathing, mindfulness, and so on. Effective treatments work because they tip the scales in the right direction at the right time. If you've only been getting passive treatments, such as massage or chiropractic, you may want to consider something active like an exercise or mobility program. And if all you do is exercise and/or mobility work, it may be time to give your body some time off to heal. In reality, we're balancing these scales on a daily basis, so our choice of treatment needs to consider our individual circumstances. Were you working hard and pushing yourself when this new injury or pain developed? If so, you may want to invest more into your body and give it quality time and resources to heal. If you've been relatively inactive leading up to your pain or injury developing, you may want to consider a more active form of treatment. Your body may lack the strength or skill to do what you want. More rest won't create that. The next thing to consider is the therapist, rather than the therapy they use. It's important to have good communication and rapport with your therapist. A large part of the benefit you get in treatment is from a positive and reassuring experience. It's great to be listened to be taken care of, and to know you're in good hands. Now, some might dismiss this as placebo, and essentially it is, but it's a valuable part of treatment, as long as it's not used to deceive. Placebo becomes an issue when the mechanism and method of your treatment is deceptive and not rooted in scientific principles. If a therapist claims they have a godlike gift, you should go to someone else. If a therapist claims that their method is the only method that will help and that your recovery is dependent on the work they do, you should go to someone else. Healing isn't dependent on the therapist. It's dependent on you and your ability to create a healing environment within yourself. With this in mind, I don't believe the type of therapy matters as much as we might think. It's certainly not irrelevant. Some therapeutic models are absolutely better than others. However, I see no value in making general recommendations about a specific therapy because the most important step in getting better is recognizing the control we have over ourselves. So let's do a quick recap of what we've covered. First of all, we want to rule out any sinister causes of our back pain by consulting a doctor. Our doctor should be familiar with modern pain science, a biopsychosocial model, and should carry out a thorough assessment before an X-ray or MRI is ordered. Consider a second opinion before starting treatment if your doctor cannot cater to these requests. You should strongly consider a conservative approach based on exercise, adequate rest, lifestyle changes, and mobility work before any kind of surgery, injection, or medical procedure. Understand that any, quote, abnormal findings on an X-ray or MRI may be unrelated to your pain. These may be equivalent to wrinkles on your skin. They're simply a part of aging. Consider where your health is tipped. Are you demanding too much of your body? Maybe you need to reduce the demands or increase your resources, or both. Are you largely inactive and living a relatively stress-free life? Maybe you need to challenge your body more and gain strength and mobility in your joints. When picking a therapy, see how it fits into this concept. Do you need something to help you unwind and invest more into your body, like a passive form of therapy? Or do you need to build strength and mobility to challenge your body? When choosing a therapist to work with, avoid those with a God complex who claim they have a unique gift for healing. There is no one therapist who has all the answers or the one true method of healing. Avoid therapists that make you dependent on their work and keep you coming back for months at a time for passive treatments. Unless you're following a corrective exercise program, you shouldn't need weekly passive treatments to improve your alignment or release your muscles. Find someone you can have a good relationship with and be upfront about your expectations. Find someone who can explain in simple terms what they do and how it can help within the context of a biopsychosocial model. So that's it for this video. Please share it with anyone you know who might need it, and be sure to subscribe for future videos. If you're in pain and you want more power and control in your recovery, get my free Ultimate Guide to Pain. You'll find the link for that in the description. Thanks for watching, and I'll see you in the next video.